Hi everyone, thanks for joining. We're going to get started now. Just a reminder, 30 minutes, one question, one follow-up. Today we have Dr. Yaffe and Dr. Huyer here today, so I'll turn it over to them for some brief remarks.
Thank you very much, Alex. Good afternoon, everyone. I hope everybody had an enjoyable and safe Family Day weekend. I am pleased to be joined here today by Dr. Dirk Huyer, who's Ontario's Chief Coroner, coordinator of the provincial outbreak response, and a member of Ontario's COVID-19 vaccine distribution task force. Since our last update on Thursday, Ontario is reporting an additional 5,225 cases of COVID-19. And in the last 3 days, Ontario has reported daily case numbers under 1,000. 981 on Sunday, 964 on Monday, and 904 cases today. Although there has been some recent fluctuation in case counts as part of Toronto Public Health's migration to the provincial case and contact management information system, these current numbers do reflect the latest situation in the province. Our 7-day average is now 1,035 cases per day, and that's about 25% lower than the same period last week. We're also seeing a declining number of deaths and hospitalizations related to COVID-19. Over the last 7 days, there has been an average of 23 deaths per day, as compared to an average of 45 deaths per day in the same period last week, and an average of 817 hospitalizations, which is about 20% lower than the same period last week. While these are obviously encouraging trends, we do want to acknowledge that these are people who have lost their lives or who are seriously ill from COVID-19. And we do offer our condolences to the friends and family who have lost loved ones, and offer our thoughts to those who are recovering from this disease. With respect to testing, yesterday we reported 30,355 tests completed, and today we're reporting just over 27,000 tests completed. These low volumes are often observed following a weekend. The average percent positivity over the last 7 days is 2.7%, which is down from 3.1% the last week, same time period. Today, we're reporting a total of 319 confirmed cases of the variants of concern in Ontario to date. Of those, the vast majority, 309, are the B117 variant, otherwise known as the UK variant. 9 are B1351, or the South African variant, and 1 is the P1, or Brazilian variant. These variants of concern have now been confirmed in 15 different public health units in the province. So public health units with 10 or more cases include Simcoe Muskoka, which of course had that really severe outbreak in Roberta. 49 cases in York, 38 in Toronto, 38 in Peel, and 18 in Durham. The vast majority, again, are the B117. Based on analysis of the data, 81% of the cases of the variants of concern are either outbreak-associated or close contacts of a confirmed case. 11% have no epidemiological link identified, and 7% are travel-related. Based on the most recent data we have from the Public Health Ontario Laboratory, approximately 7% of screened COVID cases are due to a variant of concern. So overall, our recent data is showing some improvement. As was noted in the modeling brief last week, the public health measures are paying off. We're seeing declining mobility, declining cases, declining positivity, and declining hospitalizations. These trends are what allowed the first 3 public health regions to go into the framework last week. Those are Hastings, Prince Edward, Kingston, Frontenac, and Lennox, Addington, and Renfrew. And this is what has allowed an additional 27 health units to be reclassified into the framework as of today. This is also what is enabling our students to return to the classroom with enhanced safety precautions. While there is reason for some optimism, we must continue exercising caution, given the rates in many health units remain high, and the emergence of the variants remains a significant threat. Maintaining public health interventions is important, and we must all continue to follow them in order to get transmission of COVID-19 under control. We are not reopening the province. This is not permission to start gathering with your friends and co-workers. This is not the time to get complacent. I am strongly urging everybody to please continue to stay at home and limit non-essential trips and continue to adhere to public health measures so as to protect yourselves, your loved ones, and your communities. With that, I will turn it over to Dr. Huyer for any comments that he may wish to make, and then to the media for questions. Thank you.
Thanks, Dr. Yaffe, and good afternoon, everybody. I think just to reiterate a couple of the comments and hold them in a bit of a different way that Dr. Yaffe. Clearly, there's improvement. Clearly, there's demonstrative change in the numbers. But as Dr. Yaffe said, we have to continue to be cautious and aware. We've talked about a decreased number of people that have died, but people are still continuing to die. And Dr. Yaffe provided the condolences. I want to echo those condolences to the family and friends and communities that have lost their loved ones, many who have probably suffered for a period of time with the illness. Recognizing there's still 817 people in hospital. That's almost the same as the 904 numbers that we talk about as far as new cases go. And the variants are present in now approximately 7%. So as we see some potential increase in the proportionality of variants, we have to continue to follow the steps that we've taken, as difficult as they are, to continue to keep that variant number down, to keep the case number down, to keep people well, and to keep people out of hospital. All of that occurring in the context of staying home, staying safe, and therefore saving lives.
We'll go to the phone lines. Just a reminder, 1 question, 1 follow-up. Over to the first question, please.
Your first question comes from Jack Howen from Queen's Park Briefing. Jack, please go ahead.
Hi, Dr. Yaffe. I was speaking to David Fisman, who said the province misinterpreted some of his modeling last week when Dr. Williams was talking about moving March break to April. He said that his modeling showed that the province shouldn't reopen schools and then businesses shortly after, and that doing so would actually risk a major spike in variants. And I was wondering what you made of that.
Well, I know that Dr. Fisman is quite involved in the science table and one of many people who are doing excellent work to advise the Ministry of Health and the province. As you know, Dr. Adalsteinn Brown presented the modeling information at the press conference last Thursday, and that is the modeling information that we have been using at the province to make decisions. I think that there's certainly a lot of pressure to open the schools. We have increased the protective measures in the schools, and we're monitoring extremely carefully as we do it, and working closely with the Ministry of Education, the local health units, the local school boards. So it's unfortunate that he feels that way, but we are working very closely with the science table. And I think if he has concerns, he should take them up with the chair of the science table, which is Dr. Brown. Thank you.
As a follow-up, he told me that that if one of his students showed the level of understanding that Dr. Williams had, he'd be concerned about their grasp of the subject matter. Is this sort of hostility and mistrust between government experts concerning to you?
Well, I think that's a very unfortunate comment. I think that we are seeing, as you've seen over the weekend, the hostility against Dr. Hergy in Niagara Health Unit. Certainly, we've been hearing about hostility against some other chief MOHs in Canada and public health officials in the States. I mean, I think it is concerning, and we are all doing our best to protect the health of the public, and so I think people need to appreciate these are not simple decisions. There are many factors that go into them, and having hostile comments is not helpful.
Next question.
Your next question comes from Matthew Bingley from Global News. Matthew, please go ahead.
Hi, Dr. Yaffe. I'm just wondering, when it comes to the message that you're giving the public, we've seen before from mobility data that as soon as restrictions are eased a little bit, the public generally takes cues from the government that it's allowed to go out more often, and that's often what they have done. Why do you believe that asking people to stay home at the same time as easing restrictions this time will have a different result?
Well, I think that the last time that there was a concern around this was pre-Christmas, as I recall, where York Region was still had open shopping malls, and Toronto and Peel didn't. And so I think people were doing their shopping. They were excited for Christmas, and in a way, it was understandable. Unfortunate that they did travel. I'm very much hoping that now it's not a holiday period. People understand that all these measures have had a very promising effect, but if we let loose, we are going to see another pandemic wave, and possibly worse now with the variants. So we're going to keep a very close handle on this, and if we do start to see any concerns, we are able to go back and have the stay-at-home order and put in more measures, as we call it, the emergency brake. So we're hoping we don't have to. We're hoping people will be responsible. But, the bottom line is, we have to, for now, say that even though the numbers are getting better, they're not good. They're not good numbers. People, as Dr. Huyer said, people are still dying. People are still in the hospital, ICU, and people are off ill. So we need to keep doing everything we've been doing to keep this infection down.
Experts that we've been speaking with are saying that third wave is now inevitable now, and that just managing it is another matter. I'm just wondering, when it comes to opening up schools, you say the priority is keeping schools open, and many are also pointing out that you're not allowing enough time for that incubation period to actually see if it's schools opening that's having the negative effect. Why not hold off a little bit, and especially with Toronto, Peel, and York, which there still is no answer on when they are actually opening, but possibly next week?
I mean, I think those are very good questions. Ideally, we would like to wait 2 weeks before we see a potential impact from a measure. On the other hand, we know that all the other measures that are being taken have a lot of significant deterrence and bad outcomes and negative effects on people. So it's a question of balance and decision by the government in terms of which measures to take when. But we're very carefully monitoring.
I think it's really important to build off what Dr. Yaffe said in the apparent the numbers reducing based upon all of the hard steps that people have had to take over the past number of weeks with the stay at home, with the closures. But as she's also said, there is a balance, and the balance is very difficult. It's very difficult for many different people who are staying at home, businesses, people who have health conditions. There's many, many things that need to be considered, and I think it's important that there's the opportunity for everybody to make decisions that protect themselves in the best way possible, to recognize the risk they may be placing upon themselves, but also the risk they may be putting other people at when they do go out, when they do leave their home, when they intersect with others, and thinking carefully and very thoughtfully about that potential risk that they may intersect with somebody with the variant, or they may in fact have that. All of these decisions need to be made with that consideration, and therefore taking hopefully learning and building on the work that has been done by everybody over the past number of weeks.
This will be the last question unless someone else joins the queue.
Your last question comes from Rob Ferguson from the Toronto Star. Rob, please go ahead.
Hi there. I'm wondering if we could get a little bit deeper into how much activity would cause you to trigger the emergency brake. I'm thinking of what we saw in Newfoundland last week, where they went from having very few cases to 500, 600, 700, whatever it was, and had to cancel their election on Saturday in very short order. So the government has been criticized previously for waiting too long to bring in measures. How can you assure us that this emergency brake is going to be as fast as you say it's going to be?
Well, in fact, we've asked the Public Health Measures Table to give us more specific advice on triggers for the emergency brake, but I would say one of the big ones is the percentage of cases that are the variants of concern. If we're starting to see an increase, particularly in any of the variants of concern in a local health unit, I think that is a big concern. And we would be discussing it immediately as an emergency with the local medical officer of health and determining what the appropriate measures would be. So I think that is one of the big ones. Obviously, we look at the usual, the cases per 100,000, the percent positivity, the health unit and health system capacity, but those are all the ongoing things we measure. But the big one is variants of concern, and that's why right now the Public Health Lab is actually we are testing every single positive case of COVID-19 now for sequencing. So from February 3rd till now, I think they've tested over 14,000 positive specimens, and 7% of them are variants of concern. There's no obvious pattern at this point, but if there does start to be a pattern, that would be a big concern.
Follow up?
So what level of variants of concern would it have to be up to before you would move that?
Well, I don't want to say a certain number because, sometimes it depends on the specific situation. I do recall, I think that Dr. Brown in his modeling, I believe, said 10% is when it would start to really skyrocket. But again, we'd be looking at by health unit as well. Is there an outbreak in a health unit? Is it more widespread in the community, which of course is a bigger concern? What population is affected? And of course, we're learning more as we go about the variants of concern as well. So again, I don't want to say a specific number, but it's more the trend and how it's being transmitted is a concern.
Yeah, I was just going to add that changeover, as far as the trend of that and the pattern, is clearly an important observation as we think through and observe this. And the daily numbers are being carefully watched for the variants and which variants they are.
Next question.
Next question comes from Laura Stone from the Globe and Mail. Laura, please go ahead.
Hi, doctors. I'm just wondering, when we look ahead to next week, what's going to happen with the 4 regions that haven't moved into the framework yet? Has there been any discussion with them about extending their time in the stay-at-home order or delaying their transition to the framework, or do you expect them all to go into the framework in some capacity next week?
There is ongoing discussion with those 4 health units, and no decision has been made yet to my knowledge.
Follow-up?
And there's been lots of talk today about sick leave and whether the current federal program should be strengthened and who should strengthen it. What are your views on whether there should be a provincial program to fill in the gaps of the federal benefits? And can you respond to some criticisms that the federal program is not equal to provincial paid sick leave program and is too slow and not enough money to help people who need it?
I'll start, and then I think Dr. Huyer would like to add as well. First, I want to say that having sick leave benefit is an important factor. People need to know that if they're not feeling well or they need to go get a test, they're not going to lose their pay. Because otherwise they may not comply. They may go to work and spread the infection. So there is a federal program, and I know that we're working with 15 high-risk neighborhoods to ensure that people are accessing as much as appropriate with the federal program. And beyond that, I think I'll turn it over to Dr. Huyer.
I think the comment that I have is the recognition that this is an important issue, an issue that has been regularly a topic of conversation. Dr. Yaffe and I don't have specific answers to that question except for recognizing the importance and the fact that this is recognized by many equally as important, and that those discussions are ongoing.
Last question.
Last question comes from Amanda Pfeffer from CBC. Amanda, please go ahead.
Hi, I have a couple of questions about the vaccine rollout. We understand that Pfizer was delayed because of the storm. We're also hearing that Moderna shipments across Canada may be being redirected to the north. Can we confirm and explain what the impact of that may be?
Pfizer perspective, it is my understanding that there was a snow delay. The plans for a delivery of Pfizer by the vaccinators has flexibility within and is built into the plan as to the exact days that delivery may occur. So that is, yes, a one-day period of time, but it doesn't change our plan. It will allow us, it will be one day later that things will be moving forward with that. Moderna is already, there already are allocations to the north that already is built into the allocation, as I understand, from the federal government. And there is some decrease that is coming to Ontario. But again, we are within our plans and have built a response and have a plan to ensure that there is distribution to all of the public health units to focus on the priority populations. And we're continuing forward with finishing essential caregivers and staff within long-term care homes, higher risk retirement homes, and First Nation elder care facilities. Also moving into the highest priority of the healthcare workers, those who are patient-facing and at greatest risk of exposure and also greatest potential for transmitting to populations. And we're continuing with the subtable, the First Nation subtable, and the First Nation plan called Northern Remote Immunity, where First Nation communities are receiving vaccination at this time, and planning is ongoing for urban Indigenous delivery as well.
Follow up, and this is the last question.
I'm wondering what we know now about vaccine hesitancy and whether we are starting to build or think about what kind of policies we should have at long-term care facilities, et cetera, what the timeline is for building new policy about that and what we know about vaccine hesitancy.
So I'm not sure what policies, but I'll give you, open up for one more follow-up, given that I'm not 100% sure. I'm looking at Alex. But from a vaccine hesitancy perspective, early on we did observe that in a variety of settings, and within the long-term care facilities there was some vaccine confidence may have been greater within the healthcare workers. The residents was a significant uptake of vaccine. What was done was learning from those who had questions, listening to those who had questions, providing information. There were a number of meetings with those healthcare providers in the long-term care home setting as well as the retirement home setting to provide information, provide opportunity for questions and answers, and we continue to provide that opportunity for vaccination as we return back to do the essential caregivers and rest of the staff. If there were some that had not chosen to take that opportunity earlier, we provide that opportunity still since that time. Given the fact that we don't know at this point about whether the vaccine protects from infection and protects from transmissibility, we're still learning about that. We have some progressively increasing information. It still is important that people will maintain the proper precautions with use of PPE and public health measures with masking, with washing hands, with physical distancing, and using care when providing direct care to patients. And there still is testing that will occur of the staff that are attending in the long-term care home settings until we have greater understanding about the efficacy of the vaccines from protecting from getting the illness.
Thanks, everyone.